Right now, take a moment to think about everything that our healthcare workers are dealing with, things that the rest of us just don't have to. There's a new study on 1,200 healthcare workers in China that found increases in severe mental health issues like depression and anxiety. Researchers say it is critical that those workers receive the therapy for the trauma that they're experiencing. Dr. Mary Gail Frawley O'Day specializes in this type of trauma, and she is with the nonprofit Presbyterian Psychological Services here in Charlotte, and she's joining us now. Thanks for being here.
You're welcome.
Dr. O'Day, let's talk about the extreme situation that healthcare workers are in right now. They're facing so much, both physically and mentally.
Yes, they are working long hours. From the first person interviews that I've seen, it is extremely troubling to them that they are watching people die alone, that families can't be with their loved ones in the hospital, and that they're concerned about the equipment shortages that they have, both to protect themselves and to be able to treat patients the way they've been trained to do so.
So what can the impact of that type of extended stress do to someone?
Well, I think you're going to see healthcare workers develop post-traumatic stress disorder from this, and those kind of symptoms are anxiety and depression, a feeling of helplessness, sleep disorders, eating too much or drinking too much, and just feeling guilty that they weren't able to do more for their patients and for each other.
Absolutely, because they're human too. What can hospitals do to better support our healthcare workers?
I think that hospitals can, first of all, just validate the stress and the strain that these people are under. Let them know that they are aware of it, that they care about it. Give them lists of community mental health professionals, and especially mental health professionals that are expert in the area of trauma. Presbyterian Psychological Services is trauma informed. We have a trauma team, and it's important that people who are familiar with trauma work with the healthcare folks to meet them where they need to be met and provide the kind of services they really need.
And I know that Presbyterian Psychological Services plans to offer some free therapy sessions. Tell us how that can work.
Yes, if they call us and identify themselves as healthcare workers, we will provide 3 pro bono sessions. And then, unlike a lot of mental health providers, we do take all the major insurances, and we also have income-based sliding scale fees. So we'll do everything possible to make it accessible and affordable for the people who are really on the front lines of this war.
Yes, they are on the front lines. Dr. O'Day, thank you so much for your time.
You are so welcome.
Now, for more details on those free sessions for healthcare workers, go to presbypsych.org, or you can call 704-554-9900.